question is, are the Chaoulli ruling was 4-3. There were only 7 justices on the bench for that decision. Had there been 9, maybe it would have been different, but I'm not sure. You see, I mean, Justice Deschamps wrote the leading opinion, and then she was supported by 3 justices from Western Canada, actually. And they were even stronger than her because she said it goes against the Quebec Charter, but the 3 justices from the West of Canada said, no, it goes not only against the Quebec Charter, but it goes against the Canadian Charter as well. So they made it even worse in that case. But it's difficult to say because sometimes, justices will seem to be right-leaning in the case, and they'll be left-leaning in another case. It's very difficult to label the way we hear about the American justices, for instance. You see, where they are one behind, and they go the same direction in decision. It's difficult to say that. There was a concours de circonstances in this case, I would say, because there were only 7 justices. That's what made it more fragile. It would have been more difficult to had there been 9 justices, I think. And maybe I'll answer another question while we're at it. Maybe it's not there, but if you allow me, Maggie. Another question asked if the Chaoulli decision could be overturned. Well, I mean, strictly speaking, the Chaoulli decision, no, it will be overturned. The Supreme Court of Canada is the last instance. You cannot go higher to ask it to be overturned. However, the question is still important because there are some similar cases going on now in Ontario, in BC, another one in Alberta, also trying to say that the derivative of private insurance is to be declared unconstitutional. So maybe the Supreme Court of Canada will be faced with that question again, but the facts will be different, right? And the composition of the sitting of the bench will be different. So yes, the decision may be different. And the Supreme Court sometimes says, we've decided this, but now we're changing our mind. This does happen in other occasions. So it is possible. But that's a long way down the road. The Chaoulli decision took about 5 years, at least, before it reached the Supreme Court of Canada. These other cases in Ontario, they're still at the level of the Superior Court. No decision has been made yet. So you look down the road another 5-6 years before the Supreme Court of Canada is saying, but okay, my main message tonight, damage can occur before that. Don't wait for salvation from the Supreme Court of Canada. It's going to be too late. Damages will have been done before. I mean, it's important to fight those cases. I'm not saying we should go to the court. We've got to fight again from. Don't let anyone get
Put my speaker on again. You could hear her say, I think this was to give us a smile. Can Chaoulli be deported back to France? Thank you. That's okay. I'll just ask this question. Will the CETA have negative impacts on our healthcare system? CETA stands for Canadian European Trade Agreement, and the premise of CETA is that, at least from European perspective, is that the European businesses would have total procurement rights in all of our publicly owned and delivered and funded services. So that would not mean just healthcare. That would mean all your municipal services, your education services. This is what they're trying to negotiate with the Canadian government right now as we speak. Probably some of you noticed we had a petition on the table for protesting CETA, and we will continue that petition at the Guelph market if you're interested in coming down to do that. But that is the premise of CETA impacting us as Canadians and Canadian businesses. But do you see that as affecting our healthcare system anywhere specifically?
Well, I think that the free trade agreements generally, you can see that in the discussion, the free trade agreements generally are indeed, I'm not an expert on international free trade agreements, to first put that disclaimer, but I believe that it is important and it may do a lot of damage. Once we decide to stop the contract, see, as long as it remains public, we are protected. We open up to the possibility of takeover from those international, multinational corporations, actually, when the public system subcontract services to those. I mean, you are in it in Ontario and in BC with the labs, for instance, because it's already done outside of the public system. So then you can't stop international businesses from bidding. That's the rule that public markets are subjected to. Therefore, it goes. Quebec has it now with the renewal of its subway stations in Montreal. Again, now for years, Quebec wanted to give it to Bombardier because the plant is in La Pocatière and there are, I don't know how many hundreds of jobs there. But they have bidders from France, from Spain, and from China, and they want to be allowed to bid as well on this multi-million-dollar thing. So if we introduce that into healthcare, we're subjected to the same thing.
And the other part of this question is whether the LHINs fit into this, and I'll try and answer that. The LHINs are responsible for taking the budget from the health ministry, and then in their area, we're LHIN 3, for example, they distribute the money to all of those services that they feel are needed in the community. And for those services that they cannot fund, I guess it's on their perception of what's a priority. When they can't serve, this is when they decide to do their downsizing and to look for options of privatizing some parts of the services, if not all of them. So I don't think the LHINs are going to continue the way we know them. In fact, I don't think they're going to work at all. But do you have a question? Because we did say we were going to allow. We're going to allow questions from the floor. You can ask it now.
Sure, yeah. What are the incentives for the federal government to subsidize these private entities with public money? What are their incentives? Is it strictly foreign corruption?
It's an interesting and tough question, because we can ask the same question about all of our public policies. Why do governments sometimes enact public policies that seem to run counter to the public interest? Of course, we all have our own definition of public interest. I don't know how to answer this question, except we only have hypotheses, right? The hypothesis being, the strength of the lobbies, the funding of our political parties, what interests in terms of our governments looking after, right? Your question goes to the core of our democracy, of our political system. And these occur within healthcare, but you can see the same thing. Why do we not favor more widely public transportation, for instance, in Canada? Why did we sponsor the car industries for the last? You see, it's the same thing.
Why do we sponsor the doctors in training if they want to do this?
Yeah, but some people will answer, well, listen, the